Good morning. It's so good that we have you join us for this conversation this morning. Daybreak began a while ago, and we are glad if you're just tuning in. You're just in time for a very important conversation. It's October, a month that sometimes it's better known as the pink month. And the reason why this is a very critical month for us is because we get an opportunity to escalate the conversation on breast cancer. And something that should be done each and every day, by the way, but October is just around the peak of it. Conversations around breast cancer, creating awareness, having stories of those who've triumphed on that journey to battle cancer, just to inspire hope and to tell you and I that cancer is indeed treatable, and actually it is something that we can be able to fight and overcome. And that is exactly what we want to do this particular morning, creating awareness and inspiring you. And I have with me in studio a lady and a gentleman, and allow me today to begin with a gentleman for obvious reasons, Dr. Solomon Mutua. Dr. Solomon is a clinical oncologist, an expert in medical and radiation oncology. He heads the oncology department at the Nairobi West Hospital, has studied both locally and internationally on matters medicine, surgery, and oncology radiation. And he is here just to shed the light on what breast cancer is and the basics that we need to know even as we create awareness. Thank you, Daktari, for creating time for us.
It's a pleasure to be here. Thank you.
All right, and we have somebody who's worn that shoe, and I choose to call her a warrior this morning. Her name is Melody Narteki Ochieng. Melody is a cancer survivor today, a living testimony that cancer is indeed treatable and it is not a death sentence. We are so happy to have you this morning.
Thank you very much.
All right, and I'd just like to start, with your story. A few years back, this wouldn't have been you. Why it not for the fact that you took this positively and you braced yourself for this particular fight? 2019, that was when you were diagnosed with cancer.
Yes.
Take me back there. How was it, even finding out, that you had cancer? What's the story, Melody?
Wow, thank you very much, Safin, and thank you very much, Citizen, for having us. So 2019, in August, I started feeling some pains in my breast, my right breast, and it was a sharp pain that kept coming and going. And on top of that, I felt like there was a lump. So I hate hospitals, if I may say that. So I was, doing everything to avoid the hospital, but the pain was persistent, and I couldn't even sleep. So I had to call my doctor and ask her about it. So she asked me to come and do an ultrasound. So from the ultrasound, that was the first time I heard the word malignant, but I didn't understand. So of course I had to go to Google. So I Googled, and they said it means it might be cancerous. So, of course, from there, I freaked out, and my doctor was like, no, just relax. Let's do a biopsy. So we did a biopsy, and I remember that was a very traumatizing season for myself and my husband, because at that time he had also gone for surgery. So actually it was a Sunday, I remember very well, and the doctor was like, I can't break the news to you alone. I need your husband to be here. And I'm like, he's in hospital, he's been discharged, so he might not be able to make it. So why don't you just tell me? She's like, no. So, yeah, my husband came driving. He was not supposed to, but he's like, this is my wife. I need to be there for her. So he came, and the doctor was like, yeah, it's what we're all not looking forward to. And to recommend the doctor, I really appreciate her, because she didn't really break the news in a scary way. She was gentle about it, and that is something I would really plead with our medical practitioners.
Yeah. Let me take you back.
Okay.
So you discover you have some sharp pain.
Exactly.
Did you think, or did it click what it could be? Were you guessing? Were you asking yourself questions, and even being exposed to this information that it could be, cancer?
Yeah.
Is it something you ever even thought about before?
Not at all. It never crossed my mind it could be cancer. because I normally tell people I come from a very healthy family. We don't have any medical history of, you know, any chronic diseases or anything. We are very healthy. So, in fact, when I broke the news to my mom and my brother, they were very surprised. They were shocked. They're like, "We're from this. We've never had anything like this in our family."
So
yeah.
How are you receiving this news? How are you processing it at this time, you know? Having thought that you were coming from a healthy family,
yeah.
what happened to you, you never even thought about it, and then now you're being told. How did you receive that news?
It was very difficult. I remember crying, but, you know, the fear of the unknown, let me put it that way. I didn't know what was ahead of me. And most of the news or most of the information we've heard about cancer is you end up dead, the treatment is very expensive, you know, so you're looking at your medical cover, you're looking at your finances. So I was thinking, you know, about all that, and most of the time you don't hear success stories. All you hear is someone went through the treatment and they lost their lives, or someone maybe lost their family and all that. So it was a mixture of so many emotions, so many feelings, and yeah, it wasn't easy, but I thank God we're here today.
Yeah, and it's good that you're here, because one of the things you said, before you were exposed to information and awareness, you actually thought that what you only knew was the stories you had had, that cancer leads to death and all that.
Exactly.
But it's good that we have you, so that you can change that narrative for somebody who probably has been thinking the same.
Yes.
Yeah, to tell them that it's not a death sentence.
Yes.
And Daktari, just to rope you in on this, you know, for many who are interacting with a story like, you know, Melody's story, and may not even have an understanding of how close a home breast cancer is, just expose us to how big of a problem we are talking about as we mark the Cancer Awareness Month. First of all, what are the numbers looking like, or the cases that we are discussing, for us to be concerned and have this very important discussion?
Okay, thanks, Safin, for that question. And the story of cancer really is showing a worrying trajectory, because forgetting about breast cancer, just looking generally at cancer, currently globally, it's the #2 killer in the world, second to cardiovascular diseases, yeah, which is your hypertension, diabetes, and all that. Locally in Kenya, it's the #3 killer, second to the cardiovascular diseases and the fact that we are still battling infectious diseases. So in the coming years, in the coming decades, it's postulated that cancer will overtake all those causes of mortality, and at some point in our lives we'll be facing cancer as the #1 killer, both globally and locally.
Why so?
It's just how the trends are. It's just how research and studies and scientists are seeing and postulating what may happen in the future. And when it comes to breast cancer in particular, it's the commonest cancer in females. Okay, the lifetime risk of a woman getting breast cancer in their life is 1 in 8 women. So you can see that's pretty high ratio compared to other cancers. For men, we can say our gender favors us when it comes to breast cancer, because only 1% of all cancers, meaning women are 100% times more at risk of developing breast cancer than the males.
But it does happen.
It does happen in men, and most patients, usually, or most people, get surprised when they learn that men can get breast cancer. But the bigger question to ask is, do men have breasts? And the answer is yes, we do have breasts, only that they're not as pronounced as the women. So yes, men do get breast cancer, but only that the risk is very low. So the numbers are quite common for women, but globally, the story of cancer is actually showing a concerning trajectory for the future.
And that's where I want us to dig deeper, because you're saying that in the coming years, observing the trends and what research is showing, is that this could surpass the other causes of death and become even the leading cause, you know, both globally and locally. Have you identified what could be, you know, leading to that particular kind of informing that trajectory and some of the maybe risk factors or causes of cancer that we should be aware of?
Yeah, the risk factor basically, first of all, what breast cancer is cancer generally is a genetic disease. And when I say genetic disease, I don't mean hereditary. Okay, genetic just means that there's an abnormality in the genetic makeup of an individual. Okay, like a break in a DNA causing abnormal growth. So cancer is a disease of abnormal cell growth. Now, breast cancer is when you have that abnormal growth localized in the breast. So there are different risk factors, and just the way Melody said, she was wondering why she was getting breast cancer in their family. She comes from a healthy family. It's always good to remember that most of the cancers that we have in the world are not hereditary. That means that cancer gene, most of the time, it's not passed from parent to child. Okay, most of the cancers occur sporadically, meaning they occur by chance, around 80 to 85%, and only 10 to 15% are inherited. So risk factors are there, quite many, because breast cancer is quite common. So a lot of research has gone to identify what these risk factors are. And commonest is age. Okay. Fine, it's always a blessing to grow older and see the later years, but also that comes with increased risk factor of breast cancer. And this is because as we grow older, our immune system becomes a bit more inefficient in discovering damages in our body, and therefore that immunosurveillance process is actually diminished as we grow older. So the older we get, the higher the risk of breast cancer especially, and also other cancers. Other risk factors are, of course, family history of breast cancer. So if you have a first-degree relative who has breast cancer, then the other family members also get the risk of getting breast cancer. Things like early menstruation, okay, late menopause onset, and this is because it exposes the woman to a lot of estrogen, because breast cancer is one of those cancers that is really hormonal driven most of the time. So if you get a young girl getting her menses earlier than 13 years, and those women who get their menopause onset late, 55 to 60 years, then you get their risk of breast cancer increases.
All right. But should a parent to such a child be concerned? Like,
they shouldn't really be concerned, because you see, this is just the forces of nature. There's nothing really you can do about it. It's just developmental milestones of an individual. So parents should not get paranoid that my child has started their menses at 9, 10, and then now you start having alarm bangs ringing all the time and looking at your child's breast to see if it's just a risk factor, but it's not a determination that that child will get cancer. It's just something that has been associated. Lifestyle also quite important, and also to explain why the trajectory is looking grave. And lifestyle here comes drinking, alcohol. Alcohol actually has a very strong association with breast cancer, and the sad thing about alcohol and breast cancer is that there's no really safe amount of alcohol. You can't say that I take little alcohol, so I'll be safe.
Oh, really?
So, but
a social drinker, you know, just
still,
once in a while.
Still, it has been shown to it's better if you're alcohol free when it comes to breast cancer. And of course, the more you drink, then the higher the risk of breast cancer. Smoking has an association, but not as strong as alcohol intake. Okay. And in lifestyle also, weight, obesity especially, and this really has a strong association when it comes to the post-menopausal women, okay, because after onset of menopause, the estrogen hormone goes down, okay, but when you find obese women post-menopausal, in their fat cells, they are still able to convert more estrogen precursors into estrogen. So they'll have a relatively higher estrogen levels, and therefore increasing their risk of breast cancer. But the inverse is true when it comes to premenopausal women, where obesity is actually seen as a protective factor against breast cancer. But of course, this is not to rubber stamp and endorse obesity in the young women. Of course, it's something that should be shunned. Physical inactivity goes hand in hand with that. Diet, again, for breast cancer, some association, again, in the postmenopausal women. And this is mainly high fatty diet, really discouraged, especially in the postmenopausal women. And important.
So they always advise that you watch what you eat on a regular day, but the more advanced in age you become, the more reason why you should even be more concerned about what you eat.
Definitely, definitely, because we always say we are what we eat. So basically, food is what actually defines us.
Okay. So let me come to you, Melody. So there was that season where you were in that moment of asking yourself why, because you thought, I mean, I come from a healthy family, so why would this even happen? Was that question ever answered? Did it ever make sense?
Actually, I normally tell people I never got to ask that question. That question was answered even before I was like, God, what's up? Yes, I remember.
But you had those moments.
Yes.
Like,
yeah,
making sense.
At all. Yeah. And, you know, the fear, the panic. At that time, I remember my daughter was 2 years, so it was kind of hard. I remember coming from surgery, and, you know, she's 2, she doesn't understand what is going on.
Was she still breastfeeding at that time?
No.
Okay.
Yeah. So I had a tube, you know, attached to my breast to drain the fluids that were coming from it post-surgery. So she's like, Mom, carry me. You know, I just broke down because I'm like, I wish I could, I can't. But she didn't understand. So I had to go down and, you know, pick her up with my left hand. And yeah, as I was saying, I didn't ask why. I asked, what's the reason? As in, what's the purpose for this? I came to realize nothing happens to us by chance. As Doc has said, whether it is lifestyle, whether it is genetic, whatever reason it could be. Let me bring my Christianity here. I believe everything is ordered by God, so, and it's for a purpose. So in his own mercies, he decided he doesn't give us bad things or sicknesses, but he allows. So in his own mercies, he allowed this to happen so that I could also be able to do what I am doing now, which is helping other cancer patients also get better, have hope, and to know that they can live after cancer. Yes.
All right. So talk to me about the stage that you are in, because one of the biggest concerns, Dr. and you can correct me if I'm wrong, is that most people get the diagnosis when it's already advanced. It's already, you know, they've taken so long for this cancer to be discovered. I don't know at what stage you got your diagnosis.
Yes, mine was.
Did it help?
Mine was stage 2B. I'll say it didn't really help because at the end of the day, it is cancer. So the stage at that point, okay, for me was not really an issue like this is cancer. You know, what am I going to do with?
It's still a big deal.
Exactly. And I've spoken to a few patients. I've even seen some at stage 1, and it's still a big deal at the end of the day. So the stage doesn't really affect the patients from what I've seen, like, you know, the sickness itself, the diagnosis.
Because it is still a big issue for you. That actually this is happening in your life.
Yes.
But Doctor, just to weigh in on the same issue, that concern that, you know, has been raised before, that probably if it is detected earlier, there are better chances of treatment. Maybe you can just, you know, emphasize on that. Does it help?
Definitely. And it's always good for everyone to know that cancer is not always a death sentence, that cancer does have a cure. It all depends on when we catch it. Okay, of course, the earlier we get it, the better. And also it depends what type of breast cancer you have, because we have some that are more aggressive than others. So what does stage really mean? Stage just means how advanced your cancer is. And usually in my clinic at Nairobi West Hospital, I prefer categorizing cancer into early, intermediate, and advanced, as opposed to stage 1, 2, 3, 4, because that last word 4 usually instills a lot of anxiety and fear in patients. So early cancer basically is your stage 1 and 2 disease, where the tumor is just localized in the breast. And when you come to intermediate, what we call locally advanced, it's when now it's more noticeable, it's larger, the breast is swelling, and also there are some glands in your armpits or around your collarbone. So that becomes locally advanced, your stage 3 disease. And then now when it comes to advanced cancer, that's when we call it stage 4 disease. And this is when cancer, in medical jargon, we say it has metastasized. But what that simply means is it has spread from the breast to another organ. And breast cancer can spread from the breast to the brain, to the skin, to the bones, to the lungs, to the liver. And depending on what cancer, it can even spread to your digestive system and even reproductive system. So yes, cancer when caught early is curable, but when it is detected late, that is in locally advanced, yes, it is curable, but that means the risk of it coming back is slightly higher than when it's caught early. And then ultimately when it's caught late in stage 4 disease, or the advanced disease, this is a stage that unfortunately it's not curable. And curable means that at one point I tell my patient, you are cancer-free. So when it's stage 4, and especially if it has really advanced, then you find our treatment is aimed towards controlling the disease and just helping the patient coexist with the disease, as we shall see later on. All
right. And I'll come back to you also just before we even talk about the treatment, to tell us a bit about how to just, what do we do in our regular life as women to be able to detect some of these issues when something is off, or, you know, what do we do so that we can be able to prevent or even detect it early enough for it to be treated? But let me get to hear more about you. Right now, you're cancer-free.
Yes.
Yeah?
Yes.
So many years down the line, and it's a journey that has not been an easy one.
Exactly.
Yeah? If one was to wear your shoe right now, they would understand what you've had to go through to be where you are today. Yes. Just take me through how you transformed from, let me say, a cancer patient to a cancer survivor or a cancer warrior. There has to be something that happened in between there. What happened?
Yeah, I think my turnaround moment was, there was this day I couldn't sleep the whole night, and I literally saw myself going, because I couldn't eat because of the chemo. I couldn't sleep. My emotions were all over the place. I was vomiting. You know, I was on medications because my immunity kept going down. So I kept having injections to boost my immunity. So there was this day I just decided to pray. I'm like, God, give me a word, you know. And I love reading Psalms, and Psalm 23 has been my favorite Psalm, but I had, you know, the way you read something, but you never catch the revelation or the insight of it. So all I heard in my head was, though I walk through the valley of the shadow of death, I will fear no evil, for thou art with me. Thy rod and thy staff, they comfort me. And for me, that was it. I remember also calling my mom, and she prayed over me. She's like, you're my daughter. I gave birth to you. I take authority, and I claim your life back into your body, you know. So these two, of course, my husband was there. He used to pray for me continuously. I normally catch him sometimes doing this to check if I'm breathing, because, you know, you're so weak. You're just like, you know, like that, and you look lifeless. So, of course, yeah, I recommend him, of course, but it's at times when I find that, you know, when you're going through chemo, your senses are highlighted. So I could smell everything. So him doing that, I could now smell him literally. And
that was when you were still...
That was when I was still feeling bad. I was in a very bad state. So all that helped me to come back, and I was like, there's something here for me. There's something for me to do. This this is not just a sickness that's happened to me. This is something for me to transition into another phase of my life. So I finished the treatment, thank God. I finished in September 2020. So during the time of COVID, I was busy, getting into hospitals with all the risk attached to it and all that. But I thank God I never got infected with COVID. Yeah, so I finished, and my husband was like, I've seen this sickness, is something very harsh, and most of the time people don't talk about it. So how can we help patients? How can we reach out to share our experience? And also
I want you to hold that thought, because something interesting you're doing right now, just turning your journey into a story of purpose and inspiring others who are walking that journey right now to battle cancer. Something amazing that you're doing.
Yes.
But just before that, so your cancer journey was a 1 year?
Yes, it was 1 year.
How many sessions can you recall?
Yes, I think I did 8 sessions of chemo and 25 sessions of radiotherapy from Nairobi West Hospital. The chemo was at MP Shah. Yes.
All right.
Yeah.
All right. Let's talk about, first of all, before I lose track of this, let's talk about the prevention, because awareness usually comes in handy to prevent a disease that we're discussing. Talk to us about what lifestyle changes women need to do or adopt to be able to, first of all, prevent and even to detect cancer at an early stage.
Yeah. As you rightfully said, this is awareness, and the awareness goal is to fight breast cancer. So I think the most important underlying behavior that we have to change as Kenyans and as Africans and as humanity is just healthy, health-seeking behavior, okay? Being aware of our body, being aware of our breasts. And before I come to that awareness of our body, breast cancer is one of the cancers where screening has been shown to really reduce the risk of death from this disease, because screening actually gives us an opportunity to get it when it's still early, okay? And the screening modality here is mammogram, okay? And a mammogram is simply an X-ray of your breasts, okay? And there's a way we know how a normal breast looks like, and there's a way we know when there is a risk of cancer. And screening, when we talk about breast cancer screening, we look at the person, the average risk, the lady at average risk, and that's just any normal woman with no increased predisposition, okay? And these are usually women who have a less than 15% risk of developing breast cancer. So these are women where we start screening mammographs at around the age of 50. Okay, some guidelines tell us from the age of 45, but 50 has been shown to really be associated with catching the breast cancer and making a difference in terms of saving life. And how frequently should this be done? Every year to every 2 years. Again, some guidelines prefer 2 years, some guidelines prefer every year. It's a choice we discuss with our patients and they decide. So screening is always important, age-related screening. And another important thing also is just self-awareness, okay? It's always good once in a while, though not a really strong indicator for reducing mortality, but self-breast examination every so often is always good. And when a lady notices or a gentleman notices a lump in the breast that wasn't there before.
And you can only notice if you do it regularly.
Yeah, it's always good to go to the doctor so that you're assisted. And this is very important because sometimes you'll find during my ward rounds in hospital, you can find a new patient who has come clearly with stage 4 disease in bed because of how the disease has affected them. And when you start examining them, you actually notice they have a lump in the breast. And when you ask them, how long have you had this lump? for, believe it or not. Quite often I get the answer, I don't know, I've never felt that lump before. So that actually made me realize that actually not enough people are aware of their breast, basically. So that awareness is important, so that if something wrong is detected, then someone seeks health. And another thing that is important that I would like to discourage our population basically is waiting for something to pain before you go to hospital. Because most of the time you'll find even someone with a big mass in their face, and you ask them, where have you been all this time? And they tell you, it wasn't hurting me, it wasn't paining, you know. And the greatest opportunity about the breast is that they're outside of our body. Okay, this is unlike most cancers that are actually inside the body. So for the breast, we actually have a really good opportunity to get it early. So that awareness and following the age-related screening modalities and presenting in a timely manner to the healthcare providers so that you can get assistance.
Yeah. So before you talk about the treatment options, just explain to us the logic behind, for example, a case like Melody's that just took 1 year, and others who battle with cancer for several years and takes longer compared to what she went through. Like, what could be the justification? The
justification, as I said before, it depends on when do we get it. Okay. For most cancers, and I always tell patients in my clinic at Nairobi West Hospital, is that if your cancer is curable, meaning we've caught it early before it has spread, then most of the time the treatment journey takes more or less around the time that Melody took. You know, anywhere from 8 months, 11 months, 12 months, okay? And that one has a finite time limit because it is curable. At some point, you'll stop being treated and be told that, thank God, you are cancer-free. So the patients or the people you hear fighting cancer for years continuously, now these are the patients who have incurable cancers most of the time. And the thing about cancer is that, especially if it's incurable, it keeps on mutating with time, and you may end up going through several lines of treatment, and at some point it becomes resistant. So treatment has to be changed. So you find that every number of months or years, you find the patient has to go through new lines of treatment just because of how tricky it is to fight.
So there could be cases whereby a treatment plan that worked for one patient fails to work for another.
Definitely, and especially for breast cancer. Remember, breast cancer is many different cancers in one organ. So you'll find that patient A and patient B find they have breast cancers, but totally different cancers that are treated differently. But the number of years definitely depends on whether it was early disease or advanced. And usually the advanced disease are the ones that go over the years in terms of treatment.
All right. Yeah. Melody, that year that some may think is just 12 months, you know, that was one hell of a journey for you. Yeah. And I want you to talk to us about, you know, what a patient or somebody who is going through cancer and undergoing treatment goes through. What are the lows, those difficult, challenging things that you went through as you were battling, you know, cancer?
Yeah, okay. As I said earlier, sometimes you get to a point in the treatment where you feel like, you know, your body is giving up because for the treatment to work, of course, there are side effects. So you're battling the sickness, you're battling emotions, and what do you call it? You're just, you know, you're just there, like, what is happening? For me, as I said, that moment I shared was my wake-up call, but then it didn't end there. I remember after radio, or during radio, I almost lost my voice because the treatment, you know, I don't know how they do it, but then the radiation, you know, affected my throat, and it was a difficult time. I couldn't eat. I had to literally blend food. I remember blending ugali, vegetables, and meat, you know, to eat like a baby. And even that, it was kind of hard to swallow. And most of the time, you know, when you finish chemo, which most of the time I tell people is the hard part, because chemo, you know, you have to really build resistance to fight for your life, literally. When it comes to radio, it's not easy, but it's more bearable compared to chemo. So when you're going in and you're thinking, this is just like X-ray, you enter the machine, radiation is done for less than a minute or so, and you are out. But within a few weeks of going through that, you realize there are changes in your body, there's fatigue and all that. So those are things most people don't know, or other cancer patients don't talk about. So when someone is going through it, they are afraid. They are thinking, is this another chemo experience? And I've met a few people who are like, I don't want to go through it anymore because it's proven to be even more difficult than chemo. And yet I've survived chemo. And you know, sometimes you have to stand there and tell them, yes, I know it's difficult, but imagine it's better than where you're coming from. So hold on, fight on, and you're going to have your health back. Yeah.
Let's talk about those treatment options. What options are available, and what should a patient expect when they walk into your office and you've gotten that diagnosis that it's actually cancer you're dealing with? What is it that is on the table for them?
Yeah. Basically, breast cancer is what we call is under the umbrella of solid cancers, because in the human body we have solid cancers and blood cancers. So when we talk about solid cancers, then the ultimate cure is usually surgery. Okay, so surgery is the most important treatment modality, and this is what gives us cure. So all these other, and of course this is for early disease and intermediate disease. Everything else other than surgery is just to reduce the risk of this from coming back. And that's where your chemotherapy comes in. That's where your radiotherapy comes in. That's where your hormonal therapy comes in. These are just to cement the good work that surgery has done. So what should patients expect in treatment of cancer? Of course, surgery, if it is not advanced disease, okay? And depending on what type of breast cancer they had, sometimes we start chemotherapy before surgery. And especially if it is locally advanced, it's already big, it would be messy and improper or inefficient to do surgery. You have to give chemotherapy first to downsize and shrink the cancer to make the surgery more efficient. And then there are those that we give surgery upfront. Again, once operation is done, we now get what we call the pathological stage. And this now advises us on whether, informs us on whether a patient would need radiotherapy, or it will just be chemotherapy or hormonal therapy or target therapy, again, depending on what type of breast cancer they're having. And it's always good to know that where I practice at Nairobi West Hospital, we have a fully fledged cancer center with all these modalities from surgery, chemotherapy, state-of-the-art, what she went through, radiotherapy at our facility, and all other modalities that are needed in terms of fighting breast cancer. So it's a cancer that the whole kitchen sink is involved in treating.
As you walk the patient through this treatment plan, what do you do, you know, in terms of preparing their mind and just to prepare them for the process and to enable them be with you in that journey? Because she was talking about others saying, I cannot continue with this. It's just too much. What is it that you do to just make sure that psychologically this patient is prepared for this journey?
Yeah, and I always tell my patients that, and their caregivers and relatives, the cancer journey is a marathon. Okay, it's something that takes time. There'll be a lot of hurdles along the way. And from the onset, the most important thing is breaking the news, okay? So, and this is a skill that is not really taught in school. It's something that you come to learn on the job, and also depending on what type of a person you are. But that empathy, the way you break that news, can actually define almost the entire journey. And when you see someone saying that they don't really feel that they can handle this, then maybe it was how the news was broken. Remember, we always see the physical, the physical battle, the illness, the pain and everything. But what we don't see is the invisible internal turmoil that these patients usually go through. And most of the time, it's not spoken. You just see it in the patient's mood, anger, frustrations, and taking it out on their loved ones, unfortunately. But that's just because of the turmoil that goes on. So from breaking down, and then we take them through all the investigations that need to be done for diagnostic and staging. And then when we are formulating a treatment plan, it's always good, and I make it part of my practice, to make sure that the patient really is aware of how the journey will be. And if they're going to get surgery, chemotherapy, radiotherapy, before they go through the treatment, then we counsel them. Usually our consults take so long, almost an hour with the patient, just to educate them, to counsel them on the side effects, on the intention of the treatment, the do's and don'ts, and just a back and forth to make sure that they understand. And not just the patient, also the caregiver, the family. So you find, like I always say, mtu ni wa watu, a cancer patient comes with a clan. Okay, so all these people are anxious and they want to know how the journey will be. So that preparation, that communication, counseling, it's usually goes a long way to help this fight against cancer.
All right, Melody, I know you have a lot to add on to that, but then even as you do, because you seemed like you were relating to what he was saying.
Exactly.
There's also a lot of myths and misconceptions around cancer, and patients would come and get that diagnosis and still live in denial and say they'll go for other options. You've heard about those.
Exactly.
Too, They would go for some
juicing.
You know, others would say they would live in denial and say that they want to pray about it.
Yes.
You are a Christian,
Yes, yes.
Why did you decide to, you were strongly grounded in religion and still decided to go the treatment option? Talk to us about that aspect.
I normally tell my patients at Nairobi West Hospital, God is the one who has given the doctors the knowledge, the pharmacists, the ability and the skills to come up with these medications. So in as much as it is tough, in as much as it is painful, and you know, something you've never gone through before, I would rather you go through the treatment, because I've not just heard, but I've seen people who will tell you, oh, I'm just juicing. And, you know, juicing, what it does, it beautifies you because it is just cleansing your body. It is not killing the cancer. But when we talk about chemotherapy, radiotherapy, and targeting, which the doctors have come up with nowadays, they go attacking the cancer. They go attacking the disease. So when you say you're juicing, you're just nourishing your body.
Detoxing.
Exactly. You're not treating.
You go for the traditional medicine.
Yes. For some, it works. That's okay. For some people, it works. But it's not something, personally, I would recommend, because most people come to me and they're like, should I go for the treatment? I hear it's tough. I hear it's like this. I tell them, I would recommend you go for it. I'll recommend you go to a good hospital. I normally give an example of Nairobi West Hospital. You can see Dr. Mutua, because I've recommended a few who have come back and they're like, oh, he was gentle with me. He felt, you know, he empathized with me, you know, not a doctor that you go and they tell you, do you have land? Do you have houses? It's time to sell.
You need money.
Exactly.
A lot of money for this. Let's talk about what you're doing now. Because you have turned that journey into something very positive, that you're touching lives through your story and how you managed to overcome cancer. You know, being cancer-free, that must have been the best news you had.
Exactly, yes.
Tell us about your initiative right now.
So I finished the treatment in 2020, as I said, September. Then 2021, my husband and I decided to start it, but we weren't able to start until last year, January. So our foundation is called P23 Foundation. I have, this is our scriptural cards, which we give the patients. So it's written, get well soon. And then the scripture is here. So this comes along with a fruit basket. Why fruit basket? I realized during my treatment, we were focusing on the treatment so much, we were not thinking about nutrition. the doctors were like, give her food. So my husband is like, ugali, vegetables, meat, there's chicken, there's, you know, a balanced diet. But things like fruits and, let's say, more vegetables was not something we, like, concentrated on. Like Doc has said, diet is a very big, exactly, a very big part of whether before the treatment, during the treatment, or after the treatment. So we came up with the fruit idea. We normally give pineapple, oranges, 3 tomatoes, which helps boost your blood levels. There is also bananas. So these fruits are there to not just like make patients happy or for them to know, oh, Melody finished and she's been kind to us. No. I normally tell the patients we pray over them, first of all, and also these fruits are there to help you recover, because when you're going through the treatment, it drains you. It drains your blood. It brings down your immunity. So these fruits are there to help you. Exactly.
I'll ask you this again. Why do you do what you're doing now?
Okay, personally, I had a support system. I had my husband. He was there, like, as I told you, he will even come and check on me and pray for me. He'll be there, you know, taking care of the kids and all that. But I felt I didn't have someone who had gone through to come and tell me the realities of the treatment. When I say the realities, yes, it is hard. Yes, it is difficult. Yes, sometimes you don't feel like talking to anyone. But at the end of the day, you will be healed. At the end of the day, you'll be restored. When I tell people I've grown this hair for 3 years, they look at me like I'm a miracle worker. But I tell them the real miracle worker is up there.
And you should say that that's your real hair.
That's my real hair.
But did you lose it at some point?
Everything. All of it went. My skin was discolored. Doc can tell you when patients are going through, right now, because I have gone through, when I see a cancer patient, no matter the makeup you put, no matter the wig you put, I can identify you, because, you know, cancer literally strips you of yourself. You become a totally different person. But I tell the patients, it happens like that for you to enter into that newness, that new beginning. Because we know, for instance, the cocoon, it has to be that way for you to form a beautiful butterfly. If you don't go through that, you will not have it. But most of the time, most people think I'm going to remain like that. You know, most patients even walk to me. I remember one gentleman is like, when my wife is finished with her treatment, will she look as beautiful as you? I'm like, she will look more beautiful than me. You know, yes, God is a restorer. So just have hope and yeah, move on, have faith.
Yeah, have faith. One thing I get from you is that you need a change of attitude.
Exactly.
For you to win the war against
and it starts from here.
Your mind. You need to be very positive about this particular
about everything.
And it starts from yourself.
Yourself, yes.
Okay, we're almost winding up this conversation, but Daktari, you've given us quite a number of options, or just taken us through the treatment plan. But the concern has been the burden of cost, yeah, that comes with it. In fact, I've heard in certain quarters that some people die because of cancer, not because of the cancer itself, but because at some point they opted out of the treatment because they just couldn't afford it.
Yep.
Talk to us about the cost implications, and there's this new proposal to come up with a fund, a special fund for catering, for patients of chronic illnesses like diabetes, cancer, kidney ailments, and all that. What's your perspective on the financial burden?
And very important, because I mean, money runs the world. It determines most of the things that we are able to do, and breast cancer treatment is one of them. So globally, the fight against cancer is a very expensive cancer, just because of...
Oh, it's a cancer itself?
Sorry?
You've said it's a, it's a very expensive cancer.
Yeah, basically, we can say, yes, it's a cancer, but it's a very expensive affair. That's what I meant to say.
Okay.
And this is a global problem. And this is because of the type of disease that we are dealing with. We are dealing with a very smart disease, a disease that can evade different treatment modalities, and also the type of human resource, the type of investment that goes into training the healthcare provider, the type of investment to establish a cancer treatment unit with the radiotherapy machines, which are also very expensive just because of the technology. So what I always believe, the fight against cancer should actually, most of it should be borne by the government because it is just too expensive. The financial toxicity that comes after that journey, it's really unbearable for most of the population or the citizens. So, and that's why you see efforts by the government to try come into the fight against cancer. But I think there's always room for improvement, because when you look at most developed countries globally, or even some very well-advanced countries in Africa, you'll find most of the patients don't pay at all for this treatment in public sector. In Kenya, we haven't reached there yet, but I'm sure one day we'll get there. But the best way to fight cancer globally and locally is when the government actually takes over the lion's share of the cost.
Right now, it's actually the patient who takes the lion's share. Is it about 60% of the entire cost of the plan?
Yeah, and you'll find like NHIF has gone a very long way in helping, because before NHIF, things were even worse. But you'll find out that most of the time you reach the middle of treatment and the patient tells you, my NHIF is exhausted. And you'll also find, I work in the private sector in Nairobi West Hospital, you'll find most of our patients have insurance. But what I've come to learn is also these insurances are not really robust, and that is explained by our purchasing power as Kenyans. You find even the type of insurance we get is not the high-end insurance. It's insurance that just gives you the bare minimum. Okay, and even the corporate, most of the time our organizations just get the bare minimum insurance that, fine, most of the time it helps, but you quite often you find that it actually runs out. So it's a very expensive affair globally. But I think our government is doing its best, and slowly we'll get there.
All right, all right. Did it drain you?
Yes, it did. Actually, we had insurance. My husband works with KQ, and they have a very good insurance policy. But then we ran out, so we had to go back to them to tell them to. They have a policy where when you're dealing with chronic sicknesses like cancer, they upgrade your insurance. So for us, but before it was approved, we had to pay, because at that time treatment was due. Insurance was saying your cover is finished. So now we had to. Exactly.
All right.
Yeah.
Story that every cancer patient relates to, the cost implications that come with it. Hopefully, the plan by the government under the Social Health Insurance Bill of 2023, a proposal to have 3 funds be established under this. Key among them is the Chronic Illnesses and Emergency Fund, just to be able to help patients of chronic illnesses to, foot the burden of cost that comes with this. It's still a proposal, still under, being discussed and all that. We hope to see what will come out of this, but a step in the right direction, if you may ask me. So this is how we wind it up, but the month continues. Take charge of your own health, take charge of your own body, take charge of yourself. Be self-aware, do those, personal examinations to be able to note whether something is off, and also be part of whatever is happening during this month as campaign and awareness creations on breast cancer. My name is Safina Cheng-Ouma. Thank you so much for creating time for us. We do this again next week. Another segment to talk about matters health, but for now, have a lovely day ahead.